Hello. Hi, everyone. Hello, this is Christine Crowell, and apologies, I think I put 7 a.m., but it's actually 7 p.m. UK time. So I hope that you're able to make it. If not, you can watch the replay. So welcome to day one of week one of the 5-week challenge. So I hope everyone is doing well. How's everyone doing today? Hope well. Excellent. So I'm going to crack on. Because we've got a lot to go through. This is for 1 hour. I may go over a bit sometimes because I love to make sure that I over deliver as well. So you will be able to see the recording for those of you that have got the link. I've shared it in the actual Facebook group. I'm Christine Crowell. Like I said, I am the founder of the group, as well as this Facebook and as well as YouTube channel as well. So welcome to the Staffingpreneur. And I'm really excited because this is something that is just so amazing. This industry is just amazing. It is off the chart. So I really want you to go through and understand what this is. Let's look at week one. I want you to understand the industry. And I'm just going to wait a few more minutes because I'm just going to give everyone a couple of more minutes just to log on, because I am slightly early by 1 minute. So whilst we are waiting, like I said, I've been in healthcare for over 30 years now. I've had different multiple healthcare businesses myself. I've had multiple 7-figure businesses, and I've had healthcare business in terms of home care, care home for the elderly, staffing agency, for example, in the UK as well as in the US. I was also registered under regulated, got licenses to provide home care, as well as nursing agency where I was licensed as well to provide nursing agency services in the community, providing nurses in the community. So I've also done children's home as well as multiple care homes for the elderly, as well as supported living, sheltered housing, for example. So I just wanted to give you a brief introduction of where I come from. So I did that for about 20 years. And I decided after the 20 years, I thought, I want to be a coach now. I can teach people how to be a coach because I've been through the things that you're possibly going through or possibly going to be facing at some time. There'll always be challenges in any business anyway, but with healthcare, there's a bit more responsibility. So welcome everyone to week one. And today I'll be talking about how you can understand the industry. You really want to make sure that you are researching the medical staffing industry, including the types of agency, the types of staffing that you want to provide, because it's all well and good me saying, yeah, do this, that one. It really has to align with you. It really has to feel comfortable with you. Does it fit in with your family life? Does it fit in with what you do currently? And whether you decide to provide permanent placements or temporary, you got to look at, like I said, look at what your lifestyle is. If you're currently working, then possibly you would look at doing the temporary staffing during the morning and the evening, for example. Then if you're working full time, maybe you want to do placements where you're placing staff members permanently within an organization. Now, this is something up to you to choose. You have to decide on whether that's going to be right for you. So what I want to say to you is, what is it are you going to do? What is it that fits in well with you? Because it's really important that you choose something that's going to really make a great success for you. Okay, so let's delve in. Week 2, we're going to cover business planning, develop a detailed business plan, outlining your niche, target market, what is your competition, operational structure, which is really important, financial projections, because you need to know what money you're going to have coming in or what you can hope to achieve or achieve, for example, within your staffing business as well. Week 3, we're going to cover legal and compliance. That is ensuring that you understand the compliance and all some of the legal requirements, including your business registration, employment law, healthcare staffing regulations, for example. Week 4, we'll be going more deep into building a network. Start building relationships, collaborating with other healthcare providers, potential clients, as well as professional in the medical field. Wow, this is going to be amazing because you can go global. You can network with one another and actually become a global organization. Week 5, we go into marketing because that's so important as well. You need the money to come in. So how do you get the money? Where do you get the clients from? You'll also be going into creating your own social media accounts and also making sure your website is ready. We do a website. So if anyone is interested in having a website, let us know and we can sort out one for you, obviously for a cost. So consider what platforms you're going to use, social media platforms, in order to build your brand and engage with clients and candidates as well. Week 6 is recruitment placement, developing a recruitment strategy to attract high quality candidates. When I say high quality, they must be high quality. In order to compete in today's market, you have got to provide high quality staff members. High caliber staff members need to be provided for your organization. So I'll also be going through, job posting. We'll also be going through the recruitment software. What type of recruitment software can you use for your organization currently? We'll go through the operational setbacks and consider what the logistics is of your operations, including your office location. What are your staffing needs? What technology do you need to have in place? What infrastructure and your staffing payroll? So that's just a recap of the weeks ahead. So today we're going to go into week 1, which is how can you charge up to 1.5 to 2 times the pay rate per hour for the staff members that you're going to be recruiting, for example. We'll also be covering in the 5 weeks, tapping into the billion-dollar industry, how you're going to capitalize on the new developments in healthcare, and building and nurturing relationships for long-term success. We'll also be going through my personal success story in 2.5 years, for example, and we'll be going through learn to build systems and automation, because as a business owner, you want to automate as much as possible by getting remote recruitment teams to help you in your staffing business. We'll also be covering how to place clients with proven remote sourcing. Okay, so today's objective is that you understand the medical staffing industry landscape, types of staffing, what you're going to do, and the regulatory environment and the market demand, because you need to look at what the market demand is, not just do what you feel that you want to do. Just going to drink my water. So how can you charge 1.5 times 2 of the pay rate per hour? Now here, what I would actually start off with, and I know it seems a bit cheeky, but I would start off at 3. And then you've got room for negotiation so that when someone knocks you down, at least you're getting what you really wanted. Okay. So I know it seems a bit cheeky that you're doing this, but it's something that you need to really think about and do as well. Okay. So if you're watching the replay, just let me know that you're watching the replay. That's fine. Because, you know, at the end of the day, we want you to be able to watch when you feel like it. Okay, so let's look here. Okay, so we're now in the medical staffing arena, okay, which this refers to processes and businesses of you providing healthcare staff to facilities such as could be GP surgeries. The staff that you're looking to place could be doctors, GPs, nurses, allied healthcare professionals to fill temporary or permanent positions. Now, these are the things that you need to think about. So get your notepad and paper, write it down. What type of staff members are you going to be providing? So for this service, it's crucial that you maintain quality and continuity of care within the healthcare setting, especially in times of staff shortage. You want that care home or you want that facility to know that they can rely on you because you're not going to let them down when they really need it. Okay. That's really important because that's where you can step out in front of the smaller organizations and provide staff members that are of high caliber, but also you are always there to meet their needs so that in a crisis, you're there to support them. That's how you want them to think of you as, okay? If you're providing temporary staff. So, what is the importance of medical staffing, for example, in healthcare? The importance is that you need to fill the critical gaps to ensure that healthcare facilities continue to operate efficiently and meet patient care standards despite the fluctuations in their staffing needs. This is where you come in. Flexibility. You want to offer healthcare facilities the ability to quickly adapt to changing demands. So you all also want to think about whether you want to provide them with a long-term commitment or whether you want to provide them with a staffing on a temporary basis whereby it's just 12-hour shift. For example, there's no guaranteed hours for the candidate, for example, that you're going to place. So that candidate is going to be used to place in different businesses that you've acquired the leads from, and then you've then got them to sign the terms of business to say they're going to pay you and what hours you're going to be covering, for example. Could be ad hoc, it can be as and when they need it, but also look at their long-term needs because we really want to help support the care industry because we are human beings and we can provide the staff members, for example, whether it's permanent or whether it is temporary. It's also cost effective. So you help healthcare facilities manage their budgets more effectively by controlling the staffing costs and reducing the need for overtime pay for regular staff, because maybe that could be more to them. Because if a staff member is doing extra hours over a certain period, then that means that they could get an extra bonus, for example, or their holiday pay rate could increase because of the number of hours that they've done, for example. And now look, we've got the 4-day work week in some places in the UK. And, we need to look at how we can meet these gaps. This is where you come in as care providers. You come in and you swoop and you collect and you meet that need. So what are the key components as well that you are looking to achieve in your healthcare business? So what is it that you're able to achieve in your healthcare business? You're going to specialize, which will allow the facilities to bring in specialized medical professionals as needed, enhancing the quality of care. You also want to look at being cost effective. This helps healthcare facilities to manage their budgets, like I said, more efficiently by controlling the staffing costs and reducing the need for overtime for their regular staff. Now, that doesn't mean to say that they're not going to use you. That is where they're going to use you for the right reasons if you're providing temporary staff. If you're providing permanent staff, then you're placing the candidate then permanently within that organization, and then you just charge a fee of say 20%. So you imagine you get 20% of, say, if someone's being paid 50,000 a year, if it's a nurse, for example, then 20% of that is quite good money, isn't it? It's, you're looking at 10,000, for example. Okay. So look at that aspect, the temporary and the permanent. Which one is it that fits in with you right now? Because I want you to make a decision of whether you're going to do temporary or whether you're going to do permanent placement in your staffing agency, for example. And that's something that you'll be coming and putting and communicating within the group, because, that's what that group is for you to communicate. More and more people will be added on as well. So another thing you need to think about is the compliance and regulations. And this is by you ensuring that staff and your staffing practices meet all the legal and professional standards. So you'll be looking at placing staff, for example, matching healthcare professionals with the facility that requires their specific skill and experience. Now, with today's market and the way we think about things, it's also about heart-centered. Does that person really match that environment that they're going into? Are they going to fit in well? What type of person is the candidate? What do they like? What do they not like? What is their personality like? Are they introverted? Are they a match? Are they going to be a good match being in a noisy, busy environment if it's a hospital, for example? Now, looking at how you're going to pay your staff and also the business management side. You want to be looking at what is the pay that you're going to pay your staff members. In order for you to work out what your hourly rate is, you need to first of all establish what you're going to pay the healthcare worker, the professional, for example, what you're going to pay them per hour. Then you're going to put your 1.5, 2 times on top. But remember, I said I would start at 3 times more than the hourly rate, because you're providing high caliber staff members. You're not just providing the average staff member, you're providing high caliber staff. So why should you not charge that fee? You want to make sure that your markup covers your agency cost. This includes recruitment, credentials, insurance, payroll processing. You want to be able to provide a margin of profit. And the exact rate, this can vary on different things. And I'm going to explain this more deeply. So it could be that I'm just going to drink my water. You're providing specialized staff. So highly specialized professionals, i.e. surgeons, anesthetists, can command higher rates. And this is where you come above the rest by providing specialized, skilled level service. That is when you become high demand, but the rate is higher because the competition is low. And also the job skill is more technical. So what you want to look at is, what are the contract terms? Is it short term? Are you going to provide emergency placement? Often you'll have a higher markup, like I said, due to the additional logistics involved. What geographical location will you be working from? What area will you be covering as a healthcare provider? These rates will depend on the region, because north, south, east, and west, they all have different rates because of the cost of living. So reflect this in your community, for example. What is the demand for healthcare professionals, and what is the cost of living, so that you get the rates correctly? So rates of pay for staff. Staff pay rates, this depends on qualifications, okay? It depends on their experience and also the geographical location of the job. So wherever you are wanting to provide staff members, you need to do your research to see what the hourly rate is for that location, for example. So if you've got a nurse that gets like $50 per hour in a standard setting, but more specialized or high demand areas, agencies, the rates will be higher. So that will be a higher markup. So you will be the healthcare, for example, when you're billing a healthcare facility, your rates will be higher because you're providing high caliber staff members. Okay, so medical staffing agencies may provide a wide range of healthcare professionals, including, not limited to, nurses, licensed practice nurses, LPNs, RNs, nurse practitioners, for example, NPs, physicians, doctors across various specialities. Now, try and look for highly skilled doctors. That is where you're going to really stand out in the crowd. Okay. Same with therapists, occupational therapists, radiologists, lab technicians, and more. What specialisms can you provide that's going to make you stand out from the average agency Joe Blogs, for example? So, are you going to provide non-clinical support staff? That's in terms of healthcare workers. It could even be administrative staff. So what type of staff members will you provide? Clinical as well as non-clinical. If you choose to, you might decide to just say, I'm just going to provide nurses, and let that be your focus, because maybe the rates are higher. Or you may say, you know what, I'm just going to provide carers, certified nurse assistants, for example, because the margin for the company is higher. We'll go into the rates as well, because at the end of the day, it's not about the price that you charge, it's about what your margin is. Okay, you may be paying someone high, but what is your actual margin, for example? So by effectively managing these aspects, your agency will be able to play a vital role in ensuring that the facility, the healthcare facility, is adequately staffed and it's competent with professionals placed by you, ultimately contributing to the overall quality of patient care. Because this is what the reason why we're doing this is for patient quality care. So what type of medical, I hope you're making notes, what type of medical staffing are you going to provide? Are you going to provide nurses? Like I said, different level nurses. Maybe you may want to just specialize in nurses, providing different levels. Or you may want to specialize in doctors, various specialities. So what is current trends? What is the impact for demand? Aging population. Investigate the demographic trends in your target market. And that's for you to do, is to go and look in your target location, the countries with aging populations, where is that most? For example, what increasing needs are they for healthcare workers, for example, across all levels? So what you want to look at is sourcing world. You can find information on the research institutions. They can provide you with reports, forecasts. You can even find out from your government, from your local government, for example. So aging population, like I said. And there's also healthcare reforms. You want to stay updated on healthcare policies and reforms in your country or region that you operate in, because legislation can significantly impact staffing needs, particularly in terms of patient to nurse ratio, mandatory staffing levels, and expansion of healthcare services. Government websites, healthcare news. Check all of these things out. Outlets, there's professional associations, there's so many of them. They can be such a valuable resource for you as the business owner. There's so much technology advancement now, and we need to look at these new technologies in healthcare, because telehealthcare and electronic health records, they're changing the landscape of healthcare. And we have to move with the times. So if you haven't done that, you need to look at this, okay? There's all different ways that you can look at these things. There's IT, news, websites can provide insights into these trends to do with, digital technology, for example. So what specialisms and training needs can you identify where specializing training or certification becomes critical during emergencies? That could be infection control, intensive care. Think about what you can do to help those that need your service. You can be looking at forecasting future demand areas by looking at what the data analysis and research is, which we're going to go into this, but I just want you to be a bit more open about looking at these things as well. You can use data analysis tools to examine your employment trends, but also the trends in the location of where you want to operate, because there could be an environmental issue whereby staff members seem to go off sick a lot in that location. And that's why it's important to communicate with the government to see if they know of any issues, for example. So you want to be able to look at what the employment trends are, because they're moving. They're moving. You want to do job posting and other market indicators. This can help you to identify emerging needs for specific healthcare roles or specialties, for example. So you want to network and attend industry engagement. They go around every so often in certain locations. So there's the government organizations, there's the Integrated Care Board, there's the states, for example, if you're in the States. Collaboration is key now. This is part of CQC questions as well. Are you collaborating with your community? Are you collaborating with your staff members? Are you collaborating with other healthcare professionals to provide a quality service for all? So, what partners with nursing and medical schools can help you to understand the trends in enrollments and specialization, offering a window into the future workforce? So, what tools and resources for understanding the market demand do you need to have? So, government and industry reports, the Department of Labor, along with the industry standards, for example, the association, regular publish of reports on workforce trends and projections is where you can get this information from. Surveys and feedback. Now you need to conduct a survey and then send it to your clients. You place and you can provide valuable insights into the demand, trends, and satisfaction levels of current staffing solutions. Another way is social media and online forums. So, healthcare professionals often share and they look at the insights on social media with whether it's platforms or forums, for example. So this can be a good source of information on industry trends and needs. And you need to also look at how you can communicate with these different forums. And this is with a view to you getting work from them. So look at the environment, the regulatory environment, for example. You want to look at the licensing, certification, health and safety at work. What regulatory bodies are you tied and bound by, and that you have to adhere to what they tell you? So what compliance importance in medical staffing do you have currently in place? So you don't have any, okay. Increased demand. Factors such as aging population and expanding healthcare coverage increase the need for healthcare services. And this leads to staffing shortages as well. There's educational bottlenecks. Limited capacity in education for healthcare professionals can restrict the number of new professionals entering the workforce. And that's why it's important to treat and train and coach your staff members. This is whereby you empower them. You empower them by, if they give you a question, you put it back onto them. What do you intend to do about it? And then they're going to answer the question. The more staff members that you've got, the better for you, because they will be a bottleneck. Believe me, I see it all the time. So what specialization requirements do you have? So you want to look at what the advances are in medicines currently at the moment. What healthcare technology has been created so that there is a need for highly skilled care, for example. But it's making it harder to find qualified staff. And this also is an impact overburdened existing staff, leading to increased stress and burnout, reduced patient care, and increased waiting times for services. You also want to look at increasing the reliance on temporary or travel healthcare professionals, which can be done more, but more costly. So the retention and staffing is the retention refers to the availability, the ability of healthcare facilities and staffing agencies to help staff over time, which is closely linked to job satisfaction levels amongst healthcare professionals. So what are the challenges? What are they? Work environment, high stress environment, long hours, emotional toll can negatively impact job satisfaction and lead to a high turnover rate. So compensation and benefits is looking at the inadequate compensation and benefits compared to the workload and stress levels can reduce job satisfaction. So professional growth is location of opportunities. So what professional growth can you see as a care provider or a home care service or a medical staffing or non-medical staffing agency? What do you see as your work-life balance? So you may have difficulty in achieving a good work-life balance, particularly in the roles that require irregular long hours. So what challenges are you currently facing? Maybe you'll be faced with compliance, for example, laws, regulations, and we'll go into that in a few weeks' time. So it could also cover employment law, accreditation standards, and be challenging. Ensure recruitment practices are ethical recruitment practices, particularly in international staffing, to avoid exploitation and unfair treatment. So you want to avoid this. So confidentiality and privacy. Maintaining the confidentiality and privacy in accordance with, say, for example, if you're in the States, it's HIPAA, for example. Liberty issues. Addressing liberty issues related to malpractice, negligence, which can be complicated in situations where staff are employed by the staffing agency, but not at the healthcare facility. So what is the impact? What is the non-compliance? What is the impact for that? This can lead to legal penalties, lost licenses, reputational damage, ethical breaches, can erode through amongst healthcare professionals, patients, and the public. So liability issues can raise in financial losses and impact the ability to operate efficiently. So this is where the fun begins. So what opportunities are there in medical staffing? With the emerging markets and specialties, technology advancements like telehealth, staffing platforms, they've appeared. Global staffing. It's not just about where you are now. You can be global. You can do cross-border opportunities. So what I want you to think about is your homework for next week. Your homework for next week is that you will be writing down from what I've said today. You want to do a mini research project on a specific segment of the medical staffing agency on the actual systems itself. So you want to do, like I said, speak with the councils. For example, you want to speak with them to find out what the need is in your location and try and tailor your agency around what the need is. Don't be like Joe Blogs. Find out what they're missing, and then you do what they're missing in order for you to get stronger. Do you get me? Because if we don't do these things, we're never going to really understand what it is that we are offering. What type of agency do we want to do? Do we want to be a nursing agency, medical staffing agency? But if so, what does that mean? What does that mean? What type of staff members are you going to be placing for your agency? Will it be nurses? And I'm talking to you about this because I want you to make some notes and get this ready for the next meeting, for example, because each one leads onto another thing and you end up building. It's like building a house. You can't start off at the top. You can't do the roof first before you've built the foundations, right? So here we're building the foundations of what it is that you want to do in your medical staffing business. Do you want to have nurses? Do you want to have doctors? Do you want to have both? Do you want to have healthcare workers? What is it that you feel that you want to do? And I want you to put in the Facebook group, and I'll just show you here the Facebook group. Well, I'll share it with you. You should, some of you are actually in there already. So go in our Facebook group, write out what it is that you're going to be specializing in. Are you going to be specializing in providing healthcare workers, for example? What is it that you feel that you're going to be able to provide? Is it doctors? Is it GPs? Is it locums? Are you providing more specialist staff members, for example, i.e. surgeons? You know, and there's so many of them that need to have surgeons, for example, that you can provide them with. Because once you know what the need is, you can then start looking for it. You can start finding it, and it will come up. You'll see it will come up and you'll be like, wow, that was easy, for example. So what type of staff members are you going to be recruiting within your healthcare medical staffing agency, for example? Maybe you don't want to do nurses, and maybe you don't want to do healthcare workers. What other staffing agency can you do and build upon? Maybe you want to do scrap, for example. Maybe I'm just saying off the top of my head. So think about what those positions are that's needed. Then you need to focus on that. So I hope that was helpful for you. And like I said, your homework for next week is for you to write out the type of staff members that you want for your organization. Now, if I was to do what I did many years ago with my staffing agency, for example, I would start all over again and I would focus on the specialist roles, even though mine was specialist, don't get me wrong. However, it could have been a bit more specialized. So check it out, see what your agencies or your competitors are doing in the location of where you want to be, and then do the opposite. So there's no conflict there. So that when you need someone, you can approach them and they can do the same for you, because you've both got special things that's going to enhance the relationship between the two companies. So it will be a good collaboration for you to meet your community, for you to meet your healthcare professionals that are in your vicinity, let them know what it is that you do, and then you then look at approaching their staff, for example. So I hope that you found today helpful, and have a wonderful day. Like I said, you will be getting an email which will have the dashboard so that you can log in to your dashboard and you can watch these videos on demand. You know, you don't have to show up at that time. You watch it whenever you feel like it, where you've got that quality time where you can focus and spend the time on building your business. So I hope that was helpful for you today, everyone. I've really enjoyed this training, week 1. Like I said, week 2 is going to be amazing. So please listen to this video, listen to this replay, make some notes, journal, have an idea of who you're going to be serving, for example, and what that staff member is. For example, what positions are you going to look at filling? So thank you so much, everyone. It's been wonderful speaking with you all, and I look forward to speaking with you soon. Take care. Thank you. Bye.